Hello, my name is Abhay Patil, and today's my topic is a technical topic. Today I am going to explain types of adverse event. Uh, now we are talk about something very important in healthcare, that is adverse events. These are unexpected or harmful things that happens during or after a person receiving medical care, whether it's taking a medicine, getting surgery, or just being treated in hospitals. Now, not all adverse events means that someone made a mistake. Sometimes, even when everything is done correctly, something bad can still happen. But by understanding the different types of adverse event, we can become more aware and help improve patient safety. Let's First type of adverse event is called medication related adverse event. This means something went wrong because of medicines. It could be a side effect like feeling sleepy or dizzy after taking a pill. It could be an allergic reaction like getting rashes, swelling, or difficult in breathing after taking antibiotics. Or it could be a drug interaction which happens when two or more medicines are taken together and they react badly with each other. Sometimes the wrong dose is given, either too much or too little, and that can also cause harm. Every skipping a dose by accident can be risky in some cases. So this type of event is also about the way medications affect the body, especially when they don't work as expected. Thereafter, another type is a procedure related adverse event. This happens when sometimes some things goes wrongs during or after a medical procedure like surgery, injection, or even sometime something as simple as placing a uh, catheter. For example, imagine a patient goes in for a surgery and ends up with an infection at the surgery site, or may there's unexpected bleeding during or after the operation. Sometimes a tool or instrument used during the surgery can cause damages to nearby organs. Thereafter, type is device related adverse events. These are linked to medical devices like pacemakers, insulin pumps, ventilators, or even sometimes simple like a thermometer. If medical devices break down, malfunctions, or is used incorrectly, it can lead to injury or harm. For instance, if an insulin pump delivers too much insulin by mistake, it could cause dangerous low blood sugar. Or if a ventilator stop working, the patient may not get enough oxygen. Devices are means to help, but when they fail, they can lead to serious problems. Next, we have something called hospital acquired infections, also known as HIs. Uh, these are infection that patient gets while staying in hospital or healthcare settings. For example, a patient come to the hospital for broken leg, but while staying there, they get pneumonia or urinary tract infection. This often happens due to things like unclean equipments, pure hand hygiene, or prolonged use of medical devices like catheter. These infections are not only dangerous, but they also increase hospital stay and medical cost. Thereafter, another type of adverse event is diagnostic error. This happens when a disease or a condition is not diagnosed properly. It could be misdiagnosis where the doctors fails to detect the illness, or it could be delay diagnosis, where the correct diagnosis is made but it comes too late. Sometimes it's a wrong diagnostic where a patient is treated for the wrong condition. All of these can lead wrong treatment, delay in proper care, or a serious complication. Diagnostic errors are hand to catch, but they are an important type of adverse event. Thank you.